Welcome to This Explainer. Today, we're tackling a massive question for all you ocean lovers out there. Can you actually safely scuba dive with atrial fibrillation? It's this incredibly complex intersection of cardiovascular health and extreme environments. But hey, don't worry, we're going to break it all down for you right now.
All right, let's just dive right into the roadmap for today. We're covering 1. Understanding atrial fibrillation. 2. Why diving multiplies risks. 3. The medication dilemma. 4. Who can still dive. And finally, 5. Practical advice for divers. Okay, Section 1. Understanding atrial fibrillation and those baseline risks. So, atrial fibrillation, or AFib, we're talking about an irregular and honestly often rapid heart rhythm that kicks off in the atria of the heart. Now, this might be intermittent, it could be persistent, or it might just be permanent. But the absolute crucial thing to grasp here is that this rhythm abnormality seriously messes with your heart's ability to efficiently pump blood. And, your cardiovascular system is literally your body's primary engine, right? If that engine is sputtering in a normal, everyday environment, taking it underwater, under pressure, well, that changes the whole shebang. Now, some folks, they have absolutely zero symptoms, but others experience some pretty distinct warning signs while just walking around on dry land. We're talking palpitations, breathlessness, a really reduced tolerance for exercise, dizziness, fatigue, and even chest discomfort. If you've ever felt these, you know exactly how alarming they can be. But here is the absolute critical takeaway for us. As we're about to see, these exact same symptoms get drastically amplified the moment you drop beneath the waves.
Moving on to Section 2, why diving multiplies risks in extreme environments. You see, diving forces this inescapable, super rapid escalation of your cardiac workload. It's like a giant domino effect. Step 1, just immersing yourself in water physically shifts the blood from your legs straight up into your chest. Then, Step 2, that cold water immediately constricts your blood vessels. Step 3, you're lugging around all this heavy equipment, which drastically bumps up your physical effort. And finally, Step 4, the natural stress and exertion of the dive itself causes a huge spike in your body's demand for oxygen. All of this combined, it leaves a heart with AFib completely struggling to keep up. This is exactly why divers might tire completely unexpectedly, get breathless super fast, or even full-on panic in a current. And guys, that brings us to a pretty stark reality. Even a ridiculously brief loss of consciousness underwater is potentially fatal. Because AFib can cause fainting or these scary near-blackout episodes, what doctors call syncope, divers with poorly controlled AFib or rapid heart rates are just outright unfit to dive, period. Think about it. A moment of dizziness on land is a nuisance, sure. But a moment of dizziness at 60 feet deep? That is a literal, life-threatening emergency. But wait, the plot actually thickens here. The underlying cause of your AFib is often way more important than the irregular rhythm itself. AFib is super frequently tied to other heavy-hitter conditions, things like coronary artery disease, hypertension, heart failure, valve disease, or cardiomyopathy. These underlying issues massively increase the risk of sudden death or a severe cardiac event while you're underwater. Honestly, the irregular rhythm is often just the tip of the cardiovascular iceberg, which leads us directly to something called Immersion Pulmonary Edema, or IPE. This is a genuinely life-threatening condition where fluid literally leaks right into your lungs during immersion. And it's made so much worse by things like hypertension, existing cardiac disease, reduced heart function, and just getting older. Having AF dramatically increases your susceptibility to IPE. This is especially true when you hit cold water or suddenly find yourself right in the middle of a really strenuous, heavy-effort dive. And if IPE does occur, the symptoms are severe and, frankly, terrifyingly immediate. We're talking about extreme breathlessness, intense coughing, coughing up pink, frothy sputum, and just a sudden panic, or a complete inability to swim. If these strike while you're submerged, things go from bad to life-threatening in seconds. This is why self-awareness and being absolutely 100% honest about your physical state is just incredibly critical. All right, on to Section 3, the medication dilemma, where we talk about balancing these risks. So, depending on what your doctor prescribes you, you're actually facing two entirely different sets of dangers underwater. On one hand, we've got anticoagulants, meds like apixaban, rivaroxaban, warfarin, or dabigatran. Yes, they reduce your stroke risk, which is great, but they severely bump up the risk of internal or uncontrollable bleeding from things like simple bumps on the dive boat, slipping on a ladder, dropping a cylinder, or dealing with ear and sinus barotrauma. A head injury while on these is a huge red flag. On the flip side, we have beta blockers and rate control drugs like bisoprolol, sotalol, or amiodarone. These drugs are designed to deliberately slow things down. But underwater, That causes intense fatigue, drastically cuts down your maximum exercise capacity, and can trigger dangerous drops in blood pressure. So you're basically forced to balance a really high risk of severe bleeding against a massive drop in your physical stamina.
Okay, Section 4. Who can still dive? Let's look at the medical dividing line. Let's start with the hard stops. Look, diving is pretty universally discouraged if you have poorly controlled or symptomatic AF, any history whatsoever of syncope or near syncope, significant structural heart disease, heart failure, poor exercise capacity, you're dealing with unstable medication changes, you've had a recent hospitalization, or you have significant complications from anticoagulants. If you check even one of those boxes, stepping into the water is universally considered totally unsafe by the medical pros. No exceptions. On the flip side, if you fall into a very strictly controlled category, you actually might have the potential to dive safely. What does that look like? Well, it means you have great exercise tolerance, you experience zero significant symptoms, you have absolutely no history of fainting, you lack any major underlying heart disease, you're on a highly stable medication routine, and you've had a proper cardiovascular assessment. Essentially, if you can definitely sustain the heavy physical exertion required to manage an underwater emergency, you might just get the green light.
But to actually prove you belong in that safe category, diving medicine specialists strongly recommend a very specific battery of tests. And guys, this isn't just your basic annual wellness checkup. We're talking rigorous exercise stress testing, echocardiography, a highly specialized cardiologist review, and a formal diving medical assessment. You need hard, undeniable proof from the experts that your engine is not going to fail you when you're fighting a current. Finally, Section 5, practical advice for divers, specifically for those who have actually been cleared.
All right, if you get cleared, here are the practical steps you absolutely need to memorize. First and foremost, you must dive conservatively. Avoid strong currents and heavy exertion entirely. Seriously, just don't do it. Steer completely clear of cold water stress because, as we know, that spikes your blood pressure and your cardiac workload. Always, always dive with highly experienced buddies. Make sure you maintain excellent hydration. And if you feel even the slightest weird symptom underwater, stop diving immediately. Call it. Lastly, triple check that your dive insurance explicitly covers cardiac conditions. You have to take these precautions because remember, your buddy cannot see your heart palpitating under a wetsuit.
The official medical guidelines really hit the nail on the head here. They state, the main concern is not simply the abnormal rhythm itself, but whether the diver can safely tolerate the cardiovascular stresses of immersion and manage emergencies without risk of incapacitation. That right there, that perfectly summarizes everything you need to take away from this explainer. It is entirely 100% about your physiological capacity to handle extreme, compounding cardiovascular stress. Which naturally leads us to our final thought for today. Is your heart truly ready for the deep? Look, the ocean is vast, it's beautiful, but man, it demands absolute respect, especially from your cardiovascular system. Before you even think about zipping up a wetsuit again, ask yourself this critical question and go seek out a formal diving medical assessment to find out for sure. Thank you so much for learning with me today. Stay incredibly safe out there, and please take care of your heart.